Hello, welcome to DM Neurology Made Easy. This is the 23rd episode of Fine Neurophilia Quick Revision series. Let's see the Parkinsonism Part 4 video.
Now we'll go a step ahead, see what's there new in Parkinson's disease. While hearing all the circuitry, we may think that it's very easy. Easy way of learning is you study it and teach it to someone so that you have it in your mind. Habits are dopamine driven feedback loop. And when dopamine rises, so does our motivation to act. So as I am emphasizing and telling you again and again, exams may be in July or August, or maybe delayed due to some reason, or maybe early, or whatever happens. Make it a habit to learn. So, as we all know, if you are following this Fine Neurophilia series, you are learning at least something every week or some portion at least every Wednesday, because before coming to class, you are learning something. You're reading Harrison or trying, or after every two classes, you are trying to answer the questions and do the exams. So you are learning something. So it is also dopamine driven. So make a habit, increase the dopamine in your basal ganglia circuitry. So what is the neurotransmitter which is involved in the basal ganglia circuitry? We had seen the direct and the indirect pathway in the circuitry. So what is the pathway between the cerebral cortex and the subthalamic nucleus? So what we are talking about is what actually we studied regarding the direct pathway, the indirect pathway, and a new one which we came to our notice was the hyperdirect pathway. So what we are dealing with now is the hyperdirect pathway, which we know that is excitatory, and we know that the excitatory neurotransmitter in the brain is actually glutamate. And so the answer here is actually glutamate. So just revising the last topic. So we had studied last time that the cortex to striatum with disinhibition to thalamus, leading to a positive feedback. This forms the direct pathway of the normal circuitry of basal ganglia, and from striatum to globus pallidus externa to subthalamic nucleus to interna forms the indirect pathway, which is inhibitory to thalamus. And the substantia nigra acts as the policeman through the dopamine pathway, that is the D1 receptor as well as the D2 receptors. And there is a balance, fine balance occurring between these two with the help of dopamine in the substantia nigra. And this helps in the smooth movement of a normal person. So what happens is actually there is a direct pathway, indirect pathway, and what we were talking in this question was another pathway, that is a hyperdirect pathway, which connects the cortex to the subthalamic nucleus, which is excitatory. So all this is which is given in blue is actually excitatory, and the neurotransmitter involved mainly is glutamate, and all which is shown in red arrows are inhibitory and has GABA as the neurotransmitter. And the black ones are the dopamine, which has varied action. D1, there are 5 dopamine receptors, D1 to D5. And in brain, basically D1 and D2 are the type of receptors which has facilitatory as well as inhibitory action. Second question, what is the neurotransmitter involved in the pathway in the basal ganglia circuitry? Now we are talking about subthalamic nucleus and the substantia nigra pars reticulata, SNR. So we are talking regarding SNR and subthalamic nucleus. So substantia nigra pars reticulata is present in the midbrain. It is homologous to actually globus pallidus interna. So the answer, so what we are talking, again the same pathway, direct pathway. We are now dealing with what is called the indirect pathway. So we are talking about this subthalamic nucleus to the homolog, that is globus pallidus in SNR is in homologous to GPI. So we are talking regarding this connection, that is subthalamic nucleus and GPI. So this is actually excitatory. So here also the same answer comes, that is glutamate. So don't get confused when such a question comes. Just make yourself comfortable with this pathway. So read, try to write it down, read again and again regarding this pathway. So now you will be knowing that the neurotransmitter involved is actually excitatory, and it's again glutamate is the answer. Try to answer this. So read the question. It's an except question. So first see the pathway. It is between globus pallidus, externa and subthalamic nucleus. So it is in the indirect pathway. So you need to study the table. So you know that the obvious answer would be what? The obvious answer, it is an inhibitory. So what we studied was that the connection between globus pallidus externa and subthalamic nucleus is definitely a red arrow. So definitely you know that it is painted in red. It's a red arrow. So it is GABA is definitely there. Your question is actually an except question. All of the following are neurotransmitters in the circuitry except. So it's much more complicated one than you think. And so the answer is actually there in a table in Bradley. That's why I wanted you to just read. So this is actually what we are talking is actually this pathway in the indirect one, externa to subthalamic nucleus. So here, what we see is actually this is a table in Bradley. You may think that it's very confusing and all. It's all we have what we have studied in this this circuitry is just written. But apart from that, just extra points what they have written is actually this one. That is a subthalamic nucleus GPE to STN. Extra neurotransmitter which has been written is actually dynorphin, substance P, and GABA. And the others would be actually enkephalin. The others here, just you can concentrate here. So some points you just go through it. Usually some extra questions could come from this table. Just read this. If you are comfortable, if you are well versed with the circuitry or the flowchart which we have studied regarding these pathways, you will be able to answer more than 95% of the questions. 5% extra, you can get it from the table. So next question, through which one of the striatal nucleus does the basal ganglia circuitry involving the associative functioning, involving the cognition pass through? So we have studied last time that we have simplified a difficult table in the Bradley, which was concerning 5 loops in the basal ganglia circuitry. There are 5 loops in the basal ganglia circuitry, and which passes through 3 areas in the basal ganglia nuclei. So 5 basal ganglia circuitry loops, which passes through 3 areas in the basal ganglia to produce various functions. One would be cognition, one would be movement, and one would be emotion. And so that was the table which we discussed last time. So this is just a revision question. If you had remembered the last class, you would have answered the question correctly. So let's see what the answer is. So last time we had, so this is between this is about a cognition, the cognitive pathway. So what we had studied is actually the functionality or the functional areas. So the 5 loops were motor, oculomotor, dorsolateral prefrontal, orbitofrontal, and the limbic loops. And it was associated with motor, cognitive, and emotional, which was going through the caudate, putamen, and ventral striatum. And this was the pathway. So the table we were discussing was the cognitive function passes through the dorsal caudate nucleus. So the associative division passes through the dorsal caudate, and it is concerned with cognition. So what is concerned with movement is actually going through the putamen, and emotion is actually going through the ventral striatum, which is actually the limbic division. So this is just a table in Bradley. Just go through it. So this is one of the questions. So now last time we knew that the most of the questions in Parkinson's disease are centered around the drugs in Parkinsonism and genetics of PD. So this question try to answer. The genes product dardarin is associated with which of the following Parkinson's? The most, these were the tables in Harrison, which you need to know of. Last time we were discussing regarding Kufor-Rakeb disease, SNCA mutation. LRRK2 is the most common genetic Parkinsonism, which occurs in less than 40 years of age. PARK2 mutation. So gene responsible for PARK8 is LRRK2. And this is associated with a gene product that is dardarin. Dardarin means actually tremor. And so dardarin is associated with which mutation? Actually, it is associated with PARK8 mutation. So it is regarding a 33-year-old welder who presented with history of cognitive slowing. That is all regarding Parkinsonism. So welder with Parkinsonism and all the features of Parkinsonism and with an atypical gait, which we call as coke walk gait. So he walks like a coke, that is with a toe hyperextension manganese. So there is more to this. So this is otherwise called, it could be called as manganism, that is accumulation of manganese within the body, within the brain, especially in the basal ganglia. So it is usually found in welders, miners, in mining and industrial workers, also in patients with chronic liver disease, and also in patients who are on total parenteral nutrition. So these patients will be having Parkinsonism features because the accumulation is occurring in the basal ganglia, and maximum accumulation occurs in the globus pallidus. So this is actually a T1 weighted image. T2 weighted image, water white into World War II. So CSF would be white. So this is actually black image. CSF is black. So this is a T1 weighted image, and gray matter is gray, white matter is white. And here the basal ganglia shows hyperintensity. The other conditions where the basal ganglia could be hyperintense would be due to liver failure, blood products, fat, TPN, manganese toxicity, etc. Other causes of early onset Parkinsonism syndromes could be in young patients could be due to drugs. Always think of Wilson's disease, Huntington's disease, neuroacanthocytosis. You know that neuroacanthocytosis, we have to look for peripheral smear for neuroacanthocytes. We last class discussed regarding DYT5, DOPA responsive GCDH deficiency. Then Halloween disease, which is NBIA. Then all these drugs, that is toxins, that is manganese, mercury, methanol, carbon disulfide. These can cause early onset drug-induced or atypical Parkinsonism in young patients. So when before the era of L-DOPA, that is levodopa, this Parkinsonism was staged based on Horn and Yahr staging. So now it has modified into modified Horn and Yahr staging. So what do you think is the number of classification or stages in the Horn and Yahr stage? Now we use the MDS, Movement Disorder Society, UPDRS scoring system for staging. The answer is actually 5. So this was the previous staging, where if there is only unilateral involvement without any functional difficulty, it was staged as 1. When fully confined to bed, it was staged as 5. Now it has modified into 1 and further divided as 1.5 up till 5. Again, it's same as 5 only. Now we have another one is that the MDS UPDRS scoring. And we have to know that there are 4 parts of this scoring. This is a big scoring system. And part 1 deals with the non-motor aspects of daily living. Part 2, motor aspects. Part 3 is the motor examination. And part 4 is the motor complication. That is the dyskinesias, functional deficit, off period, on period, etc. So this is a very important classification. This is what we follow in our clinical practice, the MDS UPDRS scoring system for Parkinsonism. You have to be aware of all this. So this answer is actually L-DOPA. So L-DOPA study was dealing with which one of the following studies looked into effectiveness of selegiline in Parkinson's disease. So L-DOPA study, as we know, you can rule out L-DOPA study. So L-DOPA study was dealing with actually early Parkinson's disease with early Parkinson's, whether you start with levodopa or you wait for some time and then start with levodopa. And the other options were tempo, adagio. These are associated with selegiline. And the DataTop is the study. Yes, you are answering correctly. And the last option, I put the 2 options similarly. That's why I just stopped the poll. The DataTop study is the one which was dealing with the selegiline, which is a MAO-B inhibitor. And the one more molecule which it was looking into was tocopherol. So it was the DataTop study was started in 1993, And an extended version of Datatop was again done in 2002. So Datatop was done in 1993, again in 2002. So two drugs which was studied was, one was selegiline and one was vitamin E, that is tocopherol. So these all could be questions. Two other studies you keep in your mind, that is Seledo and PDMed. Seledo was in 1999 and PDMed in 2020. Just for the sake of knowledge, so Datatop top is the most commonly asked and repeatedly asked study, and it's repeatedly asked MCQ in exams regarding selegiline. And rest of the studies I'll just discuss. So again, this try to answer this question. Question number 9. So we discussed regarding the studies. So Datatop was dealing with selegiline. And last question itself, we had discussed that rasagiline was dealing with tempo and adagio. So what are the studies on rasagiline? So MAO-B inhibitors are widely studied because this is the only drug which is actually a disease-modifying drug. One of the very good drug in Parkinson's disease, even though it is a levodopa, it doesn't have a disease-modifying action. Only disease-modifying action, which is acting on the mitochondrial enzymes, mitochondria, is actually MAO-B. Selegiline, you had seen the studies Datatop, and here rasagiline. Tempo, adagio, and presto are dealing with rasagiline, and stride PD is not dealing with rasagiline. Studies on rasagiline, just keep in your mind or see this video again just before your exam. These are the studies on rasagiline. And always remember these stairs. These are stairs climb. These are stairs to climb. So first step and stride PD. These are the two studies dealing with COMT inhibitors: tolcapone, entocapone, opicapone. So remember the steps: first step and stride PD. Steps, stride. You find the step and stride over it. That is regarding COMT inhibitors. Which one of the following statement regarding COMT inhibitors is true? So what do you think is true regarding opicapone? Tolcapone, the side effect was actually hepatotoxicity and discoloration of urine. Yes, opicapone was the drug which was approved in 2020. That is the correct answer. And it can be used as a single, it is used as an OD dosage. That is one more advantage. But the others is used as either a BD or a thrice daily usage. And tolcapone, as you know, is actually not only a peripherally acting drug, it is also centrally acting. So that is one more advantage of tolcapone over entocapone. And entocapone definitely causes urinary discoloration. It causes a bright orange urine. This is the periphery and this is the central. So we have seen here the entocapone and tolcapone acts in the periphery, but tolcapone also acts in the central region. So this is the central region and this is the periphery. So tolcapone has also a central action apart from the peripheral action. And so tolcapone, as you know, it has got hepatotoxicity, so should be used in caution. It has got both central and peripheral action. It has got a dark orange brown urine. Entocapone has got dark orange brown urine. So which one of the following calcium channel blocker is being used in studies to check usefulness in Parkinson's disease? So this question I had put just because of the reason that I got a query from one of the students that in Harrison there is a word that calcium channel blockers are actually protective in Parkinson's disease, and another portion of the Harrison just shows that it is actually harm, or it is actually one of the risk factors or one of the detrimental factors or risk factors of Parkinson's disease is actually the use of calcium channel blockers. Drugs causing Parkinsonism, actually these flunarizine and cinnarizine, anti-vertigo agents, etc., are actually causing Parkinsonism, and antipsychotic agents causing Parkinsonism. So you need to know about one thing actually. Flunarizine and cinnarizine are notorious to cause Parkinsonism, that is drug-induced Parkinsonism, which is a calcium channel blocker, which acts on L and T-type calcium channels. And one the thing was that recently in 2014, what happened was this isradipine, which is an antihypertensive drug, which was FDA approved for hypertension, was thought to be useful in case of Parkinson's disease, and hence a steady PD3 study was instituted to check into the look into the usefulness of isradipine. But this study failed miserably because of its side effect. The main side effect of this drug was actually edema and severe dizziness, and hence they have come up. An NEJM article has come up that never use this drug in case of Parkinson's disease, and this study is useless. So, and but still it's controversial. So in a nutshell, calcium channel blockers are not effective in case of Parkinson's disease, and more commonly used drug like flunarizine and cinnarizine are notorious to cause drug-induced Parkinsonism. So that is actually one controversy. I think is kind of solved with this the steady PD3 study.